Let's go over briefly time frames of when you can apply for Medicare. The first time frame that everybody knows about is turning 65. Now, Medicare Social Security and Medicare tends to happen around the same time, but they're two totally different things. We're going to strictly talk about Medicare. Medicare, for most people, happens at age 65. You've worked 10 years, you're now 65. You're going to have 3 months before your birthday month. You're going to have 3 months after your birthday month for a total of 7 months. So let's say your birthday is in April 1st. Well, April 1st is your birthday month, so your Part A and Part B can start as early as April 1st. It does not matter if your birthday is on the 3rd, 4th, or 27th. It's going to always retro back to that first day of that month. There's a few other rules, but we're not going to get that deep into this. So if April 1st is your first day of your birthday month, the 3 months before will be January, February, and March. So starting in January, you can start making selections of what type plan you want, knowing that your Part A and B is going to start as early as April 1st. But you also have May, June, and July to choose. So when you're turning 65, you have a total of 7 months that you can make a decision to start your plan. Now, there's also something called special enrollment periods. Special enrollment periods are simply times of year that you had an event change. You already qualify for Medicare, but something has changed. You moved into an area, you moved out of an area. Or maybe you lost your group coverage, or 101 other special circumstances. And during those times, you can then transition into a Medicare plan as well. The two things that you need to remember is that if you decide to go with a Medicare supplement, you have 6 months from the time that your Part B starts or turning 65 to choose a Medicare supplement plan without any medical background questions. Anything after that period of time, regardless of what's happening, you're going to always have to answer background questions unless you can have some kind of guaranteed issue situation come up. That's a different story for a different video. Under normal circumstances, it's that 7-month time span, 3 months before, 3 months after your birthday. For most people starting Part A and B, there's a qualification period of 6 months, turning 65, or getting Part B for a Medicare supplement. Under a Medicare Advantage plan, it's totally different. Under a Medicare Advantage plan, there is no healthcare questions that they can ask. And I want to throw this in here real quick. Only healthcare questions that are asked on the supplement side to show you how backward, Medicare Advantage side, to show you how backwards things are. The more illnesses you may have, certain illnesses, you get a better health insurance plan than a person that is totally healthy. Now, I know that sounds backwards, but it works out that way. Just wanted to throw that in there. But on a Medicare Advantage plan, there's a couple of things that's happening. Yes, you have the 3 months after, and you have special enrollment periods, but you also have something called an annual enrollment period. Annual enrollment is what we talked about a little bit earlier. It starts October 15th of every year. It runs to December 7th. Just like when you're at working and they give you that time of year at work to change plans, this happens on a much grander scale nationwide that you can change your Medicare Advantage plan. Again, no healthcare questions. You just have to live in the area that the plan is offered. And those plans are going to always take place January 1st. There's one other time period that is very important, which is called an open enrollment period. Think of open enrollment as a trial period. It's from January 1st through March 31st. So you choose a plan during annual enrollment period, October through December. It started January 1st, and you start using the plan, and it just didn't fit and work the way you thought it was. There was a surprise of some kind that you weren't aware of. Well, during that first time of the year, you can change plans from one Medicare Advantage to a different Medicare Advantage. You can also change from one prescription drug plan to a different prescription drug plan. So as long as what they call like-to-like plans, you don't have an issue at all. You cannot change plans though. You can't go from a prescription drug plan to a Medicare Advantage plan. Call my office if you need more help with this. But you can also downgrade. You can go from a Medicare Advantage plan to just a prescription drug plan and then reinstate just your Medicare Advantage, Medicare Part A and B. So yes, there's a lot of different rules about when you can do things and when you can't do things. Call my office. We're more than happy to go through it for you, and there's never a charge for anything we do. There's no cost for our services at all. We will help you through every bit of this.